Okay, we'll go ahead and get started. I think that you guys can see the screen. This is Nicole Barber Culp on this side. It's about 5 after, so I think everybody is connected that's probably going to be on. But we wanted to share this webinar with you this morning. Like I said, this is Nicole Barber Culp. I work in maternal and child health. Elaine Russell is here as well today, and she's going to be doing majority of the webinar and talking about community engagement. But this is specifically for the package for the Healthy People Active Communities package, which has changed a little bit from the start. Our focus more so is kind of getting out there into the community and doing projects around physical activity and nutrition. And we've kind of backpedaled a little bit from when we first started this package to have it be more of the process of assessing what your community actually needs around physical activity, nutrition, anything that is related to that. So it can just be opportunities for nutritious foods or pedestrian planning. There's many facets to it that Elaine will kind of get into. Some of that could be safe routes to school. There's a lot of different pieces, but we'll talk about that in just a little bit, and Elaine will touch on some of those things. I'm gonna go to the next screen. I sent the objectives in the calendar invite, and just wanted to have that in front of you. But some of the things that we're going to go through today, if you attended our Share Fest last fall, this is kind of similar to what was presented at the Share Fest, but we might take a deeper dive today and just give a little bit more time to focus on community engagement and what that means and what that looks like, and the process within community engagement. And then also at the end, we'll have an open discussion kind of about what the efforts are that are currently going on with your health departments as well. And we'll have some opportunity for discussion and questions at the end of Elaine's presentation, and just kind of talk about the package a little bit more. So this is a little bit of what you learned at the Share Fest if you did attend. But like I said, you'll define community engagement, best practices around engaging your community, the action plan for development, implementation, and evaluation of the work that you do with your community and kind of within this package as well. And then just determining what you all might need from us moving forward. Elaine had some pilot work that she did last year with their groups, and so we just wanted to talk about some of the successes and challenges within that pilot work that is related to community engagement as well. So we'll have that opportunity to talk about that at the end too. Everybody is currently muted at this time. You can, if you have questions, you can type them into the question box. And at the end, I'll unmute you all so that you have the ability to discuss when we open that up. So moving forward, I think Elaine is next to take the microphone. Thank you for being here this morning.
Good morning, this is Elaine Russell, and thanks for choosing this package and really working on community engagement. So this package, like Nicole said, is really more about community engagement than it is of going ahead and just diving into the nutrition and physical activity strategies. And this is talking about community engagement, not just with professional organizations, but also local people or the people most affected. And when preparing for this, I realized throughout this PowerPoint, I call people local people, the most affected, shareholders, maybe stakeholders. It's all the same person. I guess I just really haven't settled on what the best terminology is to say with that. And so this is different than what we've asked in previous years. So this has been for the second year. But before that, we really just wanted to focus on your coalition and professional partners. So now we're asking you to do something different and work with people who are most affected. And not just to ask their input, but to let them work with you side by side in defining the problem, planning it, implementing it, and deciding what does success look like, and so what should we evaluate. So we know how hard behavior change is when we talk about nutrition and physical activity. Now I'm asking you as public health professionals to change your behaviors on how we do some of this work. And it's hard and it takes a long time. You're building relationships and trust, so it doesn't happen overnight. It's frustrating. So if you don't see some of the things happen really fast, be patient with yourself. So Nicole said in the handouts, there's one of the things from our lessons learned. Last year we did a community pilot with 4 different communities on community engagement because we do know how hard it is. And the reason why we wanted to really focus on community engagement is when we gave out mini grants in the past to work on farmers markets or pedestrian planning or childcare, what we learned from your reports, you said the biggest barrier was having enough partners to do the work. And the thing that helped you the most was having enough partners to do the work. And what you asked for more training on was, how do we get more people involved? And sometimes you all tell us that you plan these great events, but then some of the number of people that you're expecting actually doesn't show up. So you put all of this work and only 5 or 6 people showed up when you're expecting 25 or 30. So we want to just make sure that your time is invested well, and so people actually show up, and we think that the community engagement is really the way to do that. All of our work in nutrition and physical activity is focused now in public health through policy, systems, and environmental change. So education and awareness is a part of that as we transition into those systems and policy changes, but it's not the end goal. So education won't actually get you to the goal that we're looking for. And we know that it's really difficult to change these big systems and policies in the environment. So what we've learned is we need to make sure that we provide you enough training and hands-on technical assistance and the resources so you can actually implement and get to that goal. And in order, like we said, we really have to make sure that we focus on that family and the community engagement. And of course, this is the public health process. Engage, assess, plan, implement, and evaluate. And this process happens over and over throughout this project and throughout all of your projects. So it's not just a one-time thing. So we'll go through that throughout this presentation. Nicole said we were going to define community engagement, so here it is. It's the process of building permanent relationships with community members who will work side by side with you as an ongoing partner in any way and every way imaginable, building an army of support for your mission. And the end goal is making the community a better place with the actual people that you want to impact. I think from our grantees last year with the community engagement pilot, what we really figured out that was important is to remember that this is a process. So we really want to report that we had so many people come to an event and then they were all physically active, but that's not what you're going to get in community engagement. It's going to be a process, and there's going to be a lot of ups and downs. So these are the steps that were outlined in the MCH Healthy People Active Communities, short for HPAC. So the step 1 is designated lead contact. I'm guessing that's you, so check, we've already got that done. The second one is to develop strategies to gain community input, or we also could say community engagement. Step 3 is identify the highest priority with the shareholder, the most affected local people. And we only want you to choose one of the 5 210 behaviors. So So either work on fruits and vegetables, work on physical activity or screen time, or sugar sweetened beverages. Not all of them, and not to educate about 5210. So just pick one of these behaviors. I put steps 6 and 4 together because I think that's when you have to do them. So you're going to develop an action plan and evaluation plan with your shareholders. So when you develop that action plan is when you want to think about, well, what is it that we want to measure? And where will we get that data? And then step 5 and 7 is implement the plan, again, with the people who are most affected, and continue that engagement. So there's also the packet of handouts for the toolkit for community engagement. So you can look at the most affected when you look at step 2. And you could use these worksheets with your actual coalition, with the people that you currently have. And you really want to have this discussion about who are the most affected by the issue of nutrition and physical activity. Who has the greatest barriers? And you want to narrow your focus on this audience. So I worked with one community and they put a full list, and they listed everybody from children to teens, seniors, homeless, people in housing units. So all of those people would need something different. And if you live on one side of town, you might need something different than you need on the other side of town. So you really want to work with the people that you have currently at the table and think about who is it that we want to work with, and narrow it down to really something small. And because this is new, I would go as small as possible so you can really get a good hold of it. And then the next thing you want to think about is how will you gain input from the people that are most affected. So if you want to work with parents, how are you going to actually talk to them and get them engaged? You can also look at the next worksheet that says approaches at the top to think about this slide. So are you treating the people most affected as the consumer or as a partner? So when we treat people as a consumer, we ask them, what are your needs and how can we meet your needs? So it sounds like, come participate in this awesome event that we have planned. And that's when a lot of times it happens, where you plan this great event, but only a few people show up. When you treat people as a partner, the questions are a little bit different. So it's asking them, here is nutrition and physical activity. What's most important to you? What issues in the community are a concern? What do you think that we're doing well? Instead of always saying, we're last in this and we're ranked really low, we want to say, well, what assets does our community have that we could build upon? And instead of saying that we're going to do something, we ask them, how can we help? And we also ask, how can you help? How can you contribute in finding a solution? Who else cares about this in the community? So the partner sounds a little bit different. It sounds more like, come help us decide how to improve and decide design a programming so that it is something that your family and neighbors would want. I just want to make sure that all of y'all know that these toolkits are in the attachments on the right of your screen. I don't know how to tell you where they are.
It's under handouts.
And so if you look at that agency-based versus community-based approaches, you can have a conversation with your coalition and ask them, so how are we currently doing things? Are we doing it more agency or community-based? So are we doing it for people or with people? Do we really look at the weaknesses and try to solve that, or we try to build on the assets? Do we look at this as a problem, or do we look at it more subjective, where it's the people were places where people live? Who is doing some of the problem solving? Who defines the problem? Are professional agencies defining the problem, or are we letting the local community? So I always think about, like, if we look at the data, we have to remember that those data points are actually people. And we don't always understand it when we look through our own lens, what is leading to that problem. So that's where we really have to ask. So we want to make sure that the primary vehicle for change is really building that local capacity. So teaching people how to help you develop your action plan, how to be involved in the implementation, teaching them about, we're going to measure this. So it's sharing some of your knowledge with the people who live in your community. So there's different ways to go about it. You could go door to door and talk to people. What we really want to make sure that we're doing when we recruit people is it's more in person and one-on-one conversations. In the beginning, you don't want to start really with a survey or Facebook or things like that. Those things can come later on, but in the beginning, you want to build a relationship. So if you live in an area where you can do door-to-door, that's a good way. You still could go to a health fair and have a table, but maybe what you want to do is have a table that brings people there and gets them interested, and then say, I have another person in a quiet spot. Would you mind having a conversation with them about some of this, because we want to learn more about what's important to you. If people want to host a house meeting, that would be okay. We can let people use their cameras on their phone, or you can give them disposable cameras and let them take pictures of what they think the assets are of the community and what they would like to improve upon, and then have a conversation around those. We could have more formal small meetings or community conversations. But again, we want to make sure like how those are facilitated are more one-on-one. So even if you're pairing people up to have a discussion in a group. Sometimes we're not the most appropriate people as public health professionals to have these conversations. So we might want to find somebody in your community who is a connector. And a connector is usually not the professional. It could be a volunteer at the church. It could be just that neighborhood mom that makes sure that everybody has what they need, and it's the person that people go to. So these people just usually see the good in everyone. They're trusted, they're well connected, and they're active in civic life, and they don't even think that they're a leader. They know and they believe in their community, and they just enjoy really connecting people. So what you would want to do is think about the different strategies that you would want to choose. And so the people that you currently have, you all would develop an outreach plan. So maybe you want to do an outreach to community leaders or connectors. So who's going to do that? Which one of your partners? Where and when might you need that? And do they need any resources? So you could list any of those outreach strategies and decide who, what, when, where, and why. And again, the community conversations are really asking people what concerns you around healthy eating and physical activity. What are the assets? How can we help? How can you contribute to finding that solution? You know, what are you passionate about? What are your concerns? Who else should I talk to? And then asking them, how would you like to be contacted again? So we might think it's email, but they might not really look at their email ever. So you might have to have 2 or 3 different ways that you communicate with people. So somebody might want a phone call, somebody might want text, somebody might want an email. After you've had these conversations, you're going to have a lot of information about what people say. So it's starting that process of engaging, assessing, planning, and implementing and evaluating all over again. So you would evaluate, did we get the right people, or do we need to continue on and do more outreach? Once you have enough and you have enough information, you want to bring those people that you've talked to together and share what you learned. So find out what the greatest concerns were and get their feedback with that. So now you want to choose with the group who is most affected, the local community, whatever you want to call them. And again, narrow your focus. So together you all want to choose one of the 5-2-1-0 behaviors. So again, maybe just going to think about fruits and vegetables. Maybe it's just screen time, maybe physical activity, or sugar sweetened beverages. It's not all of them, and it's not educating on all of them. Maybe in the beginning you give an overview, but again, the priority is just to get one of those. And then you want to think about what the best practices are within each one of those behaviors. So here are some examples if you wanted to do more fruits and vegetables. So it might be increasing healthy retail or doing something with your farmers markets to make sure that you have SNAP and WIC or transportation to your market. Maybe it's healthier foods in childcare or schools or work sites or concession stands or vending machines. It could be a community garden. Anything of our evidence-based practices that would increase fresh fruits and vegetables. And you may have some of your community members come up with something a little bit more unique that we haven't heard about before. And I think we can test those things out, but that's where your evaluation really has to come in strong. You could do screen time, so that would be more in public service venues. It could be in schools, childcare, after-school programs. Remember, all of these things, we want to look at the policy, a systems change, or an environmental change. So not just education. Education might be part of it, but our end goal is to really look at the policy, system, and environmental change. So with physical activity, there's all sorts of things that you could do is to make sure that you have more opportunities. You can make sure that it's more walkable. You could do it in community, work sites, schools, childcare, any area. And then finally, sugar sweetened beverages. You could make sure that you have access to clean, potable drinking water. We can think about different ways that we can limit access. So you can think about pricing strategies. You can think about having a healthy meeting policy or a healthy celebrations where you don't have sugar sweetened beverages. We can think about limiting the marketing in the area around sugar sweetened beverages as well. So then once you all decide your priority and what evidence-based solution that you all want to test out, you would have put your action plan and your evaluation plan. So a lot of this comes straight from the training that you had last year in November. So remember, the goal is a broad statement of what you hope to accomplish. So the example here is maybe you want to increase physical activity opportunities for children. And then the SMART objective is to develop, say, maybe you decided to work in elementary, so you want to develop a safe route to school plan by the end of the school year. Or maybe this is, you all are in April, so the end of the school year is not a good time. So that's where you want to make sure that it's realistic and achievable. So, and this is just an example of what your action plan might look like. We know that training and technical assistance is really important, that it's hard to do things well without that. So if you all need some sort of training or technical assistance, make sure that you contact me or Nicole, and we'll try to connect you with whatever you need. So who would be those partners? So you would maybe need a transportation trainer. You would need the school leaders, and then all of those engagement areas with the people that you have been working with. So you want that community coalition. And you think about, okay, so did we do the training? Yes or no? And how many attended? So make sure that you put your evaluation measurements in there. Again, you are just going through that process of engaging, assessing, planning, implementing, and evaluating, and you're kind of starting over. Do we have the right people at the table to help us implement this plan? Do we have the training and technical assistance that we need? So if not, you want to put those into your plan. So you want to make sure you continue to engage your stakeholders. Together, you all might find out which the priority routes that you all want. You would assess needs for each one of those routes, and then you would develop a plan. And so the policy change or the environmental change is having a safe routes to school plan. It's not increasing physical activity yet. It's not even laying concrete yet. So you're in this process of just developing a plan so you can become more ready for more funding to actually implement and get that plan developed. I think the implementation plan, this is more of our to-do list, and often we do this in our head. But you can just make it a little bit more detailed by writing it down and making sure that you share it with the people who you want to actually help get things done. So we want to think about, how do we communicate? So we've had this meeting and we've decided who's going to do what, but it's always good to follow those best practices of having a meeting and then communicating, you said you were going to do this, and writing their name down. People are more likely to follow up that way. And remember, people show up because you ask them. They usually don't show up because they saw a Facebook post. They might not show up even if you sent them an email. So sometimes it's that personal contact that makes more people become engaged. So, so you want to really think about that communication when you think about your implementation. So you're going to have a training and host a training, so you want to make sure that you host your partners and invite your partners. So think about different ways that you can communicate with them, and then follow up to make sure, it's tomorrow. Are you coming? Do you have a ride? One of the things that we learned in our community engagement mini grants was really like buying out the barriers. So when you're working with the people who are most affected, they probably can't come at the times that we can come between 8 and 5. So you might have to have it in the evening. You might have to have babysitting. You might have to have transportation. You might have to have a snack. Or think about what those barriers are, and you can use some of your grant funds to buy out those barriers. When we talk about engaging your stakeholders, when you have a meeting with the training and you have this big to-do list, make sure that you think about each one of those partners and what they can do. So if you're going to say we're going to engage people, again, you're going to say partner A is going to work with the students. The next partner is going to work with parents. The next partner is going to work with school staff. Other partners will work on the east side of the neighborhood, and then we'll split it up, and other partners will work on the west side. So we want to make sure that we're continuing to engage people so people are participating during the planning and they feel ownership of it. And then you want to identify, say, the priority routes. So after you've collected all of this information and people who've decided where they think the routes should go, you might have to narrow it down to 2 or 3. You can list all of them in your plan, but you can say these are the top 3 that we're going to really focus on in the beginning. And you might want to think about how you prioritize them and think about easy wins versus the greatest need. So making sure that people want to come back because you're successful. Again, think about how you're going to communicate to people. So this is where you might have a bike rodeo, but it's not really so much, you're going to have 2 purposes of it. So you would have a bike rodeo so you can give out helmets and talk about safety, but you also want to get that feedback where we said we've identified 10 different routes. Which ones would you use? Which one's most important? And once you've got your priority, then you might want to do the walkability assessment so you can figure out what specific needs to be changed in order to make this more walkable and safe. Again, you're going to need partners to come out and help you because this is too much for any one of us to do. So you could, again, engage and recruit people when you're having people identify the priority. So once we've done this, we need people to come out and walk this with us and decide what we need. Again, you want to do those follow-up phone calls and ask people, are you going to show up tomorrow? So make sure that you really think about communication because that's one of the things that gets people to the table. So some of the reporting things with the MCH package, remember this is a process, so we're not looking for you to say how many people are actually going to increase physical activity. We want to think about who is the most affected. So tell us, who did you choose? How many people did you reach when you did the recruiting? What methods of engagement did you learn? or use? And then what did you learn from talking to people? And then again, same thing with the community planning. So which one behavior did you prioritize? What was the process? Who participated? How did you get people to come? What type of training did you need? What type of technical assistance did you need? What do you still need? Who participated? So it's not just you as the professional participating in trainings, it's also your community members. And then we also want to know what your successes and barriers are. And if things don't work out, that's just as important as if they did work out. So don't be afraid to really make sure that you list and discuss what some of the challenges are. So that is the quick and dirty of the MCH HPAC, also known as Healthy People, Active Communities. So this time we are going to open it up to you for questions. So there is a question box at the end, and you can type it in. And we can also unmute you, I believe.
The microphone at the top. Oh, this one?
Oh.
Just kidding. Try that one.
Does anybody have any questions that you want to type into the box? Now, how do I see this? We will archive this and have this webinar available. I can't see these. Oh, here they are. Any other questions? You're unmuted. I'm unmuted. Let's see. You can also, I think, raise your hand. Is there somebody who's raised their hands?
We're trying to make sure you guys are unmuted. So if you are talking or trying to talk, just let us know. We're trying to unmute you.
So we can read your questions. Click to unmute.
Yeah. Okay, there you go.
Oh, there's one. Oh, here's one. How do we engage people who have much deeper issues than what 5210 addresses? For example, poor housing or transportation. So we do have to make sure that we have the focus, because that's what this funding has been allocated. So it has to be around healthy eating or physical activity. But transportation is certainly going to come up, or even poor housing, where maybe you don't have like a good refrigerator or transportation. But I think that's when you take the problems, you have to listen to the people who have greater issues. And if they're saying that transportation is a problem, you might want to ask them about, so what type of transportation do you need? Is it a bus? Is it a van? Is it to be more walkable? And then take those types of that feedback and take it back to your partners. And I do know that a lot of people do have deep issues and probably won't participate, but I feel like there's always somebody in your community that will participate. And it's better to have somebody closer in your community participating than nobody at all.
You should still unmute.
All right, we're figuring out how to unmute you.
So we're unmuting you one by one. Sorry, there should be a unmute all, but if you have questions, you can go ahead and ask.
I have a question.
Are engaged in much deeper issues than what you know, such as housing and transportation?
Hello?
Which
You
one?
are unmuted, so you can self-mute by *6 on your phone.
Oh, tell me how they address your question.
If you have a question, you can go ahead and ask. Can you hear us?
I have a question.
Okay.
So we worked last year really hard on getting WIC Farmers Market in our community, a contract signed, and built a lot of excitement around this with our Chamber of Commerce, with our library, a lot of community engagement, and then we got an email from the state saying that they weren't going to do the farmers WIC program in our county. And so everybody kind of turned back to me and said, "Don't you work for this? How did like they were all upset at me? Like I felt like ugh." And so we're trying to back up and punt and do some other things, but we lost a lot of like momentum that way. So if something happens where you're trying to get towards something and you know something happens, whether that's not blaming anybody, but it just doesn't go the way you want, it's hard to redirect all of that energy. Is there any advice on how to like keep those people engaged even after kind of a disappointment or
Yeah, and that's awful that that happened to you. There's other ways that you can work with your farmers markets to make sure. So you all could sponsor like a day, which would be only a one time event maybe to start off with.
mhm,
So it might just using a little bit of your grant dollars to give kids dollars and then have a lot of activities. Also, you could, if you have SNAP available at your farmers markets, or you all could work towards that. Other people have raised that funding in their own community. So instead of doing double dollars where you have WIC and then you double it, you might just be saying, if you just show me your WIC card, we'll give you an incentive. So
okay, okay,
that type of stuff. Now, some of your grant funding does not allow you to use it to buy food, so just be careful with that. But it might be other community money that you have.
true. And we've tried to do activities at the market to just get kind of like what you're talking about, the people who are the most affected to come, like some free events and things that aren't necessarily like um, we've targeted families in a nearby apartment complex that can walk there, to do some things with the family, so it's not seen as just a only people who can afford this can come.
Right.
So we're trying to still kind of encourage people and expose them to some fresh fruits and
Yeah.
vegetables and a different way of shopping, like
Huh?
less gas station because that part of town doesn't have a grocery store that's walkable. So, that's the one place where they can come and get fresh fruits and vegetables. It's just hard. It's like we were so excited and then like the air came out of the balloon, if that makes any sense. And it's like,
No, that's awful, though. You've planned, and then the resources that you planned for weren't there for you anymore.
yeah, it was really disappointing on
Mm-hmm.
so many ends.
Yeah,
But
and I
anyway,
think
that's just kind of
if you want to get the WIC families to it, you really want to make sure that you ask the WIC families, where is the best place for your market, or if you think about going to a child care to promote to parents, is usually a good incentive, especially if you're also working with that child care to improve their menus. So,
and their menus, yeah. Yeah. Okay, well, thank you so much.
any other questions? You can either type it in or ask if you're unmuted. Also, in your handouts, you can look at our lessons learned from our mini grant or our community engagement pilot. So some of the things that, these are all the words from our grantees. So they said, make sure that you identify who's missing, and don't just start with the same people that you always start with. And make sure that you value people as experts, because while we think that we all have the same lived experience, we're not the target audience, and so we don't always understand their barriers. We talked about buying out the barriers. If you invite somebody to come to a meeting, think how intimidating that is. So there's training that has to happen on both sides of the coin. So making sure that you train your community members, your professional partners, that you're going to have people who are not used to coming. So maybe we can use less jargon. We could make sure that we all introduced ourselves without our professional titles. Somebody talked about giving people like 3 tickets, and if you used any jargon, you had to give up one of your tickets, and then everybody else could put all of their tickets in for drawing at the end of the meeting. But we forget how much jargon we use. And really, a lot of people might, come and say, well, I'm just Jane, and they don't really feel like they're a value of the meeting when they hear that I'm in a room full of a nurse and a doctor and an epidemiologist. Make it hospitable when we bring people in. One of the things somebody said was that, when they went out and they asked people questions, that they noticed that they were leading them to get the answer that they wanted. So we have to be really intentional about not trying to drive the answer to what we want to hear, but truly listening to what's challenging. What is it like for you? We talked about when we start asking these questions to start with non-threatening questions. So it could be things like, tell me about a time about food that your mamaw fixed. What was your favorite? Where was the first place that you go to in the grocery store? So it's not so generic about how many miles do you drive to the grocery store? Where is your access? How many fruits and vegetables that you eat? So, you're building a relationship. You're getting to know them. You're dating them, really. Making sure that we ask open-ended questions. It's okay to have a list of questions that you can ask people, but we don't want to survey them. We want to have a conversation. We want to make sure that we're not leading them to a yes or no. And another thing that was really eye-opening was thinking about following this 80-20 rule. So you want to ask questions and talk to them, but you want them to do 80% of the talking. Think about how hard that is, because we're so used to spilling our guts to give you all of this information. So how do we really listen and let you talk? And make sure that we're empowering people and giving them leadership roles, that we're not always the one doing all of the work. So instead of summarizing what you heard, actually have that resident come and tell people. So maybe they would use a photo to say, this is why this is so important to me, because this is what I have to choose from. And we want to make sure that we're nurturing the relationship. So once you've had a conversation, you want to stay in touch and make sure that we're checking in to have self-ownership, but the relationship needs to be nurtured. And again, this is a process. So your numbers might be small and they might be different than what you might be if you're actually trying to say that we're trying to reach so many people. I think below we have some of those common questions that you can start. You want to think about going to their table and not always asking them to come. So any other questions about reporting or where to get the training or problem solving? Maybe somebody on here has the answer for us. All right, well, I'm going to turn it back over to Nicole to get some final direction.
All right. Thank you all so much for being on today. If you have any questions about the webinar or just moving forward with your work, please just message either Elaine and I think the next, hang on a minute. Elaine's email is right there. Invite. So if you have any questions regarding the packages, just let us know. Like Elaine said, there is additional technical assistance that is available. One thing that we didn't cover is that the obesity program actually received their notice of award for their new funding for the next 5 years. So that's really exciting. And we're hoping
to do a class or teach it, you know, tell them
everybody is unmuted. So if we could,
or something, but
if you can star 6
okay,
yourself.
I'll give a call back.
We're gonna mute everybody. We're gonna mute everybody again. There you go. Oh, we didn't mute everybody. Sorry.
No, we didn't.
All right, now everybody's muted. So there will be opportunity within this new obesity grant to provide technical assistance. Eventually, Elaine has to get back to full staff. We are down some staff in that obesity program, but there are partners that we have externally and internally that can help with some of your work as well. So any trainings or technical assistance needs that you have, just let us know and we'll be happy to connect you with who can help you with that. Okay, I think we're just going to wrap it up. If you'd like to share anything, successes, challenges with us through email, we'd love to see that too. That's something that can always be shared with others as well. So it's always good to hear what's going on in each other's health departments. So, all right, with that, guys, we're going to wrap it up. I hope you have a wonderful weekend. Stay dry. I think it's supposed to rain. And we look forward to working with you this year. Thanks.